Today I want to answer a common question that we have in the office. It is, what is the best sleeping position for back and hip problems? We should all know that sleeping on your stomach in that kind of rotated position of the hips and the neck is not good for your spine. So I definitely would recommend you do not sleep in those positions. But typically sleeping on your back or sleeping on your side can be perfect. The one exception to that is if you sleep on your side with your legs in a flexed position or like in the fetal position. With back pain, often the hip flexor muscles, the muscles that come out of the spine and attach in the hip, can become tight and actually create compression of the lumbar spine and the SI joint. Likewise, when you sit and cross your legs in a seated position, you frequently will irritate the glute muscles, the G medius and the piriformis muscles. Well, likewise, we see that same thing when you sleep on your side. A lot of particularly people, particularly ladies, when they like to sleep, they'll sleep on their side with one knee up and over or both knees up in the fetal position. And what that creates is a sitting-like position, and it causes low back and hip problems. So often we recommend that you keep your legs as long as you possibly can get it. And if you have a little bit of wider hips, you might find taking a small pillow and placing that in between your knees to take that pressure off of the hips. Likewise for shoulders, you might find putting a small pillow on your chest or kind of clutching it. That takes the pressure off of the shoulders. But both of those positions, sleeping on your back or sleeping on your side with your legs as long as possible, are the best ways to keep your back from hurting the next time you're sleeping.